Hi, everyone. My name is Jason Miller. I'm a doctor of acupuncture and Chinese medicine, and I've been presenting here at Medicines from the Earth for over a decade now. And I'm so thankful for this community and for this incredible repository of educational information about botanical medicine and so many conditions that we're able to help people with. A little bit about me. I practice out of my clinic in in Ashland, Oregon, called Jade Mountain Medicine. I do some acupuncture and body work with people, but most of the time I'm working as a consultant, as a caregiver for people with chronic disease, oftentimes with cancer. So most of my work focuses on the care of patients with chronic disease, and I work in a very collaborative way with other providers, clinicians, oncologists, hematologists, primary care doctors, et cetera. And we build a team to really come together to help patients through some of these most challenging um, health issues that people face.
I'm going to talk about cannabis in medicine, and we're going to talk about how we can use cannabis in medicine. Since there's still a lot of FDA regulations around this plant, which of course for me it's an herbal medicine, and although it's wrapped up in the pharmaceutical industry now, it's wrapped up in politics. It's a very deeply woven thread in our kind of human culture right now, and it's making it harder and harder to kind of see the pure truth about cannabis, the pure human understanding about what cannabis is and how it works. And then, of course, it keeps getting more complex as we keep playing with it, right? We're genetically modifying it all the time, whether through selection or through actually genetically modifying things. And it's interesting to me that this is a plant that has this really long history of being woven into human culture and has influenced us, and we've influenced it. And one of the fundamental ideas I get from a lot of folks that are really deep in this field of cannabis, they say that cannabis is really the one that's directing the relationship between us and it, and it's got a big guiding force in life and evolution and what's happening with us and our minds and the whole thing. And it's really an interesting thought, and one that I think is good to keep in mind as we go forward into this conversation. So, starting with what do we know about cannabis is a big kind of question mark, right? And the FDA has continued to keep cannabis as a Schedule 1 agent, right? So it basically has no medical benefits. It's got addictive, effects, and it's got potentially negative health impacts. And so it continues to be a Schedule 1 drug even now. And federal legalization is something that's in motion, and we'll see how that plays out. We also have states that have legalized cannabis locally, and then we have the whole hemp situation with the Farm Bill and all that's going on there, which has opened up the doors for a lot of research to start taking place in the field of cannabis medicine, because we've lost a lot of the historical data that we have about cannabis and about using it. As practitioners of botanical medicine, we're people who have been digging into the history about using plants and traditional medical systems from all around the world through the eclectic medical practices of the turn of the 19th 20th century. These are all deep wells of knowledge and information, wisdom that has been brought through that we can carry forward outside of all the modern research and all the the deeper scientific look at the plant and how it works. So with losing a lot of that, we've had to kind of recreate our relationship with it. But not all of it's lost. And I'm going to dig in the beginning into kind of some of the information we have from some of the historical sources, especially with traditional Chinese medicine. We'll see kind of what this plant has been doing in the terms of medical applications and how it's been used, for literally millennia. Because right now, most of what we have is in vitro studies where you're looking at, cell lines or things in a test tube or things in a petri dish, and you're trying to see how molecules from the plant would affect something. And then outside of that, we have our animal studies where we're using animal models to basically, generate a test subject for us to apply the therapeutic applications to, creating medical conditions in an animal and then, giving the cannabinoids to the animal to see how it works. But that's all, it's hard to really determine what's going on. And so as we'll see, there's a lot of mystery out there. We're using a lot of case studies information, people that are bringing case studies through, and we're also using a lot of anecdotal reports from patients, from people that have used cannabis for different things, and from doctors who have applied it also. And I put up here Rick Simpson as an anecdotal report, and that's the Rick Simpson oil is a very kind of big famous aspect of cannabis medicine. And Rick Simpson has kind of become this famous guy. And we'll talk about why that happened and what that story is as we get down the road here. So, for me, the story starts with cannabis as an herb because that's what it is. And although we can't really talk about cannabis as far as, giving dose recommendations, people sign up for medical cannabis cards in their state. They get, a little license that says you can use cannabis in your state. You get a medical card, and then you can have a caregiver and provider. But doctors, medical practitioners, providers, they're not giving really clear recommendations about the use of cannabis if it has THC in it. And as we'll see, there's definitely a difference between THC and CBD, and the hemp plant versus the kind of the marijuana plant or the cannabis sativa with THC in it. And that's an interesting element. And so any recommendations I give in here, they're not really coming from me, as a medical provider. I'm not telling you how to treat patients or anything like that. I'm basically using the data that we have out there. And then I'll also share some of my clinical experience with people who have used cannabis and share their experience with me. So starting out, I want to just kind of go back in time to, some of the earliest writings from Chinese medicine, the Shenong Bencao Jing, which the Divine Husbandman's classic of herbal medicine. It refers to cannabis and how it was used medically. And that's a pretty interesting place to start for me because it's one of the classic texts that has provided a lot of information to traditional Chinese herbal medicine. And in that book, you see that there's evidence that points to both kind of a THC-rich cannabis medicine, which has more of that, intoxicating. We're going to talk about kind of what the difference between CBD and THC and their effects in the mind, but a more mind-altering effect, an intoxicating, euphoric effect from THC. Whereas there's also references to more hemp CBD-like medicine that was more used for pain and other conditions, but without so much of that sort of mental, emotional, spiritual side. So here's just a little quote, right? In more central Chinese regions, archaeological artifacts provide abundant evidence of hemp fiber, but little evidence of drug cannabis, suggesting that the historical divergence of fiber and drug biotypes occurred early in Chinese history. So probably there was a movement towards the fibrous aspect of it. And as we'll see, the seeds and different aspects, the secondary compounds, or maybe primary compounds from the plant, I should say, lignans and fibers and things that were used, the structural components as materials versus the medicine. But early on, the medicine was clearly being used and probably was, and there was definitely a divergence of those two early on. So, we see that cannabis is really drawn into the scientific research arena, right? And it's being analyzed at the molecular level. And we're going to find out about the endocannabinoid receptor system, that network, right, of these really complex woven receptor, pathways and systems that are connected to all these other systems in our body, very regulatory system. And so this kind of recent exploration is more scientific, but we don't have that vast trove of traditional medicine to guide us like we do with a lot of other things. So that's where this first little drop in is going to take us into what we know about cannabis from the past. So cannabis in antiquity, right? The Bencao Jing text was, written around 200 AD, and there are mentions of cannabis all the way through the Materia Medica of today. And the two things that are mainly used are ma fun, the inflorescence or the flower, and then the mazi ren, or it's also called ho ma ren. That's the seed of the cannabis plant, and it's used in medicine today. Mostly it's used for bowel promotion, for moistening the bowels. As in Chinese medicine, lots of seeds are good at moistening tissue. They're rich and moist. They're a very yin thing. If you know anything about Chinese medicine, they're yin, they're moist, they're enriching and nourishing. And that quality oftentimes is what the bowels need to get moving. So we have the mazi ren wan. It's really the hemp seed pill, and it's got a lot of other herbs in it for promoting the bowels. So that's the main thing that's used today in Chinese medicine. I never learned about using cannabis, as a drug, as a real botanical medicine that alters physiological function in my medical training. But I've learned a bit about it since. It's hard not to today. And if you're in medicine, this is a topic that comes up. So ma is the word for cannabis or hemp, or the marijuana plant as it was known in Chinese medicine. And you see there's Shanong. He's this amazing doctor back in the turn of the millennia, who was basically going out and exploring all the different plants in the world and that he could find, and he would try them, use them, test them, and he gathered a lot of information from his predecessors and compiled it all into this first really powerful text with images and actions and flavors and natures. And this original text described cannabis as being acrid and balanced in its flavor and having a balanced nature between hot and cold. And its actions, you see here, governs the 5 taxations and 7 damages. That's kind of like background Chinese medicine, the things that you can be deficient in and the the pathological factors that can damage you, governs them, right? It benefits the 5 viscera. That's the main yin organs. That's the lungs, the heart, the kidney, the liver, and the spleen. And it descends the blood and cold chi. So it kind of helps things to move down, kind of calms things down. Excessive consumption causes one to see ghosts and run about frenetically. Again, this is historical text, right? Prolonged consumption frees the spirit light and lightens the body. Another name is Ma Bo. And it also was said that it relieves impediment. And impediment in this context really means pain. So there's obviously, back here 2,000 years ago, there's use of cannabis, the drug, the actual active, with cannabinoids, probably lots of THC being used. And you can see that it gets into the realm of the psychosis, which, we'll see as we look at some of the research into psychosis, that, psychosis and THC are not a good mix. And THC from cannabis has lots of effects on the mind. And that's where it's really interesting and different than CBD. And we're going to find out how those two compounds are different and why there's this, divergence between the hemp plant and the cannabis plant as a drug, as more of a THC-rich medicine. So another doctor who came along was Sun Si Miao. This was in the Tang Dynasty, in 581 to 683. So this guy recorded that the leaves of cannabis can be used to extract their juice, which could be used to treat unbearable pain due to fractured bones. Wow, that's a serious pain, right? And they didn't have the same kind of pain medications we have today. You couldn't just go to the doctor and get your opiates. It wasn't it. So having a medicine that would treat pain was really, really powerful, and cannabis was used in that way. And this was obviously, some divergent strain, some lineage. It probably was a combination of THC and CBD. Sun Si Miao is a very interesting guy and somebody who wrote kind of the maybe the Chinese version of the Hippocratic Oath, right? A great physician should not pay attention to status, wealth, or age. Neither should he question whether the particular person is attractive or unattractive, whether he is an enemy or friend, whether he is a Chinese or a foreigner, or finally, whether he is uneducated or educated. He should meet everyone on equal grounds. He should always act as if he were thinking of his close relatives. And of course, this should be altering with she to be more politically appropriate today, or just to be accurate and appropriate today. But obviously, this is the translation. So, a powerful figure who was an influence on medicine in China and has influenced world medicine. And this next text that came up, the Essential Formulas of Alchemical Classics, had this quote in it, right? That it's as close to a modern laboratory handbook as anything we are likely to find in ancient literature. Following a preface and a catalog of elixir names, there's a set of detailed specifications for necessities of the laboratory. And this is a book that Sun Si Miao wrote, right? And he's got cannabis in here, including the Liu Yinyi 6-1 lute, which was universally employed in Chinese pharmacology and alchemy for the hermetical sealing of reaction vessels. So they're obviously doing some complex alchemy here to transform materials and extract components of it. Finally, there are the recipes themselves with ingredients and the weight, advanced preparation. Advanced preparation is a big deal in Chinese medicine. You prepare a lot of herbs before you do the actual extraction. Concise directions for compounding and using the processed products. So this is just showing you that there was a very in-depth study of this medicine and herbal medicine at this time, back in the early centuries of the AD period. So one of the things that was, really notable in my research around this is that there was something called cannabis seed wine that was used back in this time. And it was a medicine that was prepared in this following way, right? So you soak the seeds in cannabis water. You soak the seeds of cannabis in water first. Then, once they're soaked, the sediment is collected from the bottom of the water. It's stir fried until aromatic. You can smell it. Something's happening in a silver vessel. And then it's ground into a fine white powder. This is then boiled with alcohol and taken internally on an empty stomach. Very interesting, right? Now, this was indicated for severe pain at the time. So these are not hemp seeds likely that's happening here. This is probably, a cannabis extract that's got a lot of potency. And how did it do that? Well, the bracts were what were used. And the bracts are these small modified leaves that come around, they enclose the seed. They're just right around the seed. And that's the part that has, if you see pictures of this, there's lots of cannabinoid, lots of little not trichomes, little hairs, right? The trichomes that are rich in oils that are the active ingredients that are on around the seed. So they would take the seeds with the bracts, soak them, and then they would take it and fry it. And when you're stir frying it, you're basically doing what today is being done is what's called carboxylation or decarboxylation. You're decarboxylating the material, which basically moves the CBD and THC and other cannabinoids from their acid state, which is a non sort of psychoactive, less activating state to the receptor networks, and turning it into a more active one. You go from CBDA to CBD or THCA to THC. We'll hear more about this down the road, but this is just really fascinating that they were doing this so long ago. And then they'd take that material once it's decarboxylated and they would put it into, the baijiu, the rice wine. My favorite thing in the world. No, I'm just kidding. When I was in China, that baijiu is just not very tasty, but it's like a really strong alcohol and it would extract the lipid fraction really well. And so they would do this, put it into the wine. And now you have this cannabinoid rich medicine that worked as an anesthetic. And that's really, kind of what cannabis was used for at that time. Definitely a lot of it used for anesthesia. And we'll see, of course, cannabis, and we know it's really great for pain. It's just how do we use it and how much and when not. So one of the things that was written about in this book, Reaching the Source of Materia Medica in 1700, was that mahua, the cannabis flower, can treat hidden wind within the body. Also that it was an anesthetic, staying with that same idea for pain. But treating hidden wind in the body is interesting because in Chinese medicine, wind is a pathological factor and it can be generated inside the body or it can be generated outside the body. It can affect us. The external wind penetrates our body. A great example is like Bell's palsy. Someone's a little bit constitutionally weak or challenged, stressed, whatever. They're standing on a hill one evening and the wind comes up really strong. It's a little bit cold. And then suddenly they get this Bell's palsy where their muscles go into spasm and twitch. That's wind. And, Parkinson's disease, that tremor, that's wind, benign essential tremors, that's an internally generated wind. So you've got both sides. And they found that cannabis flower was very useful for both of them. And, this is tics, twitches, spasms, mental illnesses, things that are windy and moving, they're itching, they're irritating. It's like, how the wind irritates you? Like, God, I just can't get comfortable. I don't feel stable. I don't feel safe in the wind. It's like you're living on a hill would be hard like that for a lot of people. It makes them irritable and it's depleting. It's depleting to the blood and depleting to the energy of the person and their constitution. It can happen on a mental, emotional, physical level. So cannabis was used to treat something called wind withdrawal, which was a kind of mental illness described at that time. And as they see here, cannabis flower treats 120 types of malign wind. That's a lot of malign wind, as well as itching, and expels all malign winded blood. It was also indicated to treat lack of free flow following menstruation. Aha. And now we just hit another realm of, application for cannabis, which I'm not going to get into much in this talk, but one that is very important also is the use of it for pain in menstruation. We'll talk about a little bit about menorrhagia and metrorrhagia, and basically dysmenorrhea, painful periods. It's very helpful for that. So this was what came about 973 AD. I just want to put this up because it's so interesting that cannabis was said to cause happiness in the heart. And in Chinese medicine, the heart is the house of our spirit, right? Our Shen. The Shen lives in the heart. And then we express the mandate of our heart, of our spirit through our tongue, which is where the heart opens into the tongue with your voice and your language. And then we shine our Shen out through our eyes. That's where you can always see in people's eyes. So it's a spirit medicine. It really is. And it's been known that way. And it's been thought of that way. So for me, there's a kind of a sacredness to the cannabis plant. It's something that has a deep deep meaning in human culture, deep meaning in human evolution. It's a powerful force for us and continues to be. And I just want to make sure that we all work on preserving the idea of cannabis as an herb as part of our herbal toolbox. Of course, with FDA regulations and things, we can't just use cannabis and give it to people. But of course, we have some nice opportunities with hemp. And as we'll see with Delta 8 THC, which can come from the hemp plant, that can also be another, form of cannabis medicine that people can get a hold of easily without having a medical card at this time. Okay. So two other interesting books that came out. We're kind of into the 1900s now, right? Pharmacognosy was a book by Li Chenghu. And this was a guy who, was another Chinese doctor. And he was applying cannabis for agitation, hysteria, spasmodic cough, and nerve pain. So now we're getting into sort of how these plants are being used, right? People were just using different types of cannabis for different things. And in 1935, this other person, Yang Huating, another doctor, was using cannabis to treat mania withdrawal, convulsions, and insomnia. So you can see it's kind of like these windy, irritable, unstable, or painful conditions. That's what cannabis was being used for and had been for centuries. So if we pull forward out of the traditional Chinese medical history, which is just remember, it's unique because there aren't many places in the world where a culture has survived thousands of years. They've never been invaded. No one came in and destroyed all their stuff. I mean, of course, they fought within themselves, right? You've got Genghis Khan, you have all these different stories about China and who took over, but there was always a unifying force to China. And a lot of their history in medicine or anywhere else is preserved. It's been there. And there are books that are thousands of years old that you can look at today. So when we get to the modern era, I should say just pre-modern, right? This book was written in 1915, American Materia Medica Therapeutics and Pharmacognosy. This is by Ellingwood and Lloyd, two of our eclectic medicine heroes in the field of herbal medicine. And what these guys said cannabis was really good for, in their experience, and they used a lot of it, was that it was a true sedative to the stomach with few undesirable influences. It was sedative, narcotic, anodyne, some pain relieving, and to a limited degree, antispasmodic. It acts upon disturbed functions of the nervous system. So now we're getting into this thing from starting at the beginning, right? Where you have that idea, like, it's definitely affecting us on this mental, emotional, neurological level. A remedy for disordered mental action, a remedy to arrest or control pain, acts in conjunction with other pain quieting agents. This was talked about in 1915. We'll see today as we get further down in this talk that it's also true today that generally when you use cannabinoids in the combination with other pain quieting agents, you get a better effect, synergistic. You need less of the other pain medication or less of the cannabinoid, less of both of them together to get a synergistic effect. Ellingwood was also, fond of using it for urinary irritation and in the treatment of neuralgia and hemicrania. Hemicrania is just, pain on one side of the head, kind of an idiopathic thing. They also said that it's great in subacute inflammation of the brain. We're going to see how that plays out in modern research today. Controls nervous system excitability, treats that functional disorder of the stomach. It's a soothing tonic to the uterine muscular structure. So there's our, great for menopause, or not for menopause, sorry, for menorrhagia, for painful periods, dysmenorrhea. Cures irritable states of the bladder. Remedy for functional impotence. Soothing to irritable bronchial coughs and laryngeal spasm. And it cooperates, works really well, and acts similar to some of the herbs that we're more familiar with, like opium, like gelsemium, passiflora, bromides, chloral, and hyoscyamus, right? Which is, gelsemium and hyoscyamus work on the cholinergic system. And they're more anticholinergics, and you've got to be really careful with dosing with them. Cannabis is a little more forgiving, but it has also kind of more complex actions. So if we pull forward to, the Western medicine kind of thing, it was this two people, William O'Shaughnessy and Jacques Moreau, that really in the mid-19th century started to describe the positive effects of cannabis preparations like hash, is used on pain, vomiting, convulsions, rheumatic conditions, tetanus, mental issues. And in 1851, it was recognized in the U.S. by the Pharmacopoeia as a useful form of medicine, as a tincture, an extract, or a resin. And it was used that way. That's where the eclectics were using it, right, all through that period. And then in 1941, cannabis was removed from the Pharmacopoeia and considered to be in the same group as other illicit drugs, right? And that's what we were talking about, how now it has that Schedule 1. And even though we have this incredibly long and well-defined history of use of cannabis as a medicine, it's been put in Schedule 1, which says that it has no medical application. So let's jump forward right out of all the history, right into the science, okay? Because we're really talking about the endocannabinoid system, which is a very beautiful and complex network of pathways of molecular exchanges happening in our body that's really being driven by endogenous cannabinoids. That means cannabinoids that are made in our bodies. If this isn't happening in all vertebrate animals, and even some other probably invertebrates, even back to like the earliest, like the little medusa, like the little aquatic animals that have cannabinoid systems in their bodies. The cannabinoid system is known to influence movement, memory, sleep cycles, body temperature regulation, appetite, the body's ability to sense harmful stimuli, and regulation of the immune system. So it's about like control and regulation. It's about normalization and homeostasis. It's really a homeostasis network. The simplest way to remember what the ECS does is to think these 5 words: relax, eat, sleep, forget, protect. And if you think about cannabis, if you've ever, used cannabis or had a cannabis experience, you can see how those things are all very directly experiential as part of it. And part of that forgetting, kind of not thinking about all the things that are out there that might hurt you. It can put you in a state of relaxation, get you into a state of parasympathetic relaxation when you eat and you sleep, and you're in that parasympathetic rebuilding state. So there's 3 primary elements to the endocannabinoid system. The endogenous cannabinoids, we're going to look at those, the cannabinoid receptors that receive the signal from those endogenous cannabinoids, and then the associated enzymes, mainly the ones that break down the cannabinoids after they've done their job of working on the receptor network. So there's 2 main cannabinoid receptors, the CB1, which is present throughout the central nervous system and a little bit in peripheral tissues, but you think of it, CB1 is generally the central nervous system cannabinoid receptor, and then CB2 is primarily in the immune system and in the gastrointestinal tract, central nervous system. There are a number of other identified endocannabinoid receptors now, but I'm not going to go into them because it's a whole other talk. We want to talk about applications and things. So, there's a lot of things that are in there, the TRPV receptors, a bunch of G protein coupled receptors. But for now, let's just talk about CB1 and CB2. So CB1 activation influences appetite, immune function, muscle control, pain, intraocular pressure, cognition, neuroexcitability, the temperature regulation of the body, and the stress response. So it suppresses locomotor activity, cools the body down. It has a pain relieving anti-nociception effect, right? It also is involved with anxiety, tachycardia, hunger, and sedation, and it can drive all those things. As we'll see, overactivating CB1 can drive anxiety. It can create tachycardia. It can create sedation or hunger. And then CB2 in the immune system has more to do with immune function and immune cell proliferation and inflammation and control of inflammation and pain. So when it comes to these 2 different main cannabinoid receptors, we're talking about THC, which stimulates both of them. It acts via the cannabinoid receptor 1, CB1, and CBD, our other main cannabinoid we're going to talk about, is the sort of polypharmacological material. It doesn't activate receptors, but it changes the receptors, it changes the enzymes, and it changes the production of the endogenous cannabinoids. So it's more of an influencer of the endogenous cannabinoid network, whereas THC is more of a direct activator, an agonist for CB receptors. So it drives changes in those connected networks. So the 2 main endogenous cannabinoids are anandamide and 2-AG. Anandamide is the Sanskrit word for bliss, and it's an endogenous cannabinoid that's associated with us feeling really well. And both of these molecules regulate cellular function by modulating the receptors, right? They interact with the receptors. These are the molecules that the body makes to change homeostatic regulation. Both 2-AG and anandamide act on the CB1 receptor. The principal endogenous ligand for the CB2 receptor is 2-AG. So 2-AG is a big activator of CB2. Again, that's that immune system regulation, right? And CBD raises levels of endogenous cannabinoids through a number of different actions. One of them is inhibiting the enzymatic degradation by this main enzyme called fatty acid amide hydrolase, which basically breaks down the endogenous cannabinoids for them to be recycled, okay? And it also blocks the anandamide reuptake, letting the anandamide be present longer so it can keep doing the job of activating the receptors and causing its downstream action. So we go and take that overview real quick. You'll see that modulating the ECS by agonizing the receptors or antagonizing receptors, by targeting its metabolic pathways, or combining cannabinoids with other analgesics for synergistic effects, as we saw, it's a great place to start. It's a great place that we can move forward and look at what's happening in cannabis and medicine. And there's a lot of work being done right now in this field because there's a lot of mystery. And mystery is really summed up here in this, the title of this study, What a Long, Strange Trip It's Been. This is looking at headaches and the use of, cannabis and headaches, and it can be useful in some cases. And that's the thing that's hardest about all this, is that there's so much complexity going on. It's very hard to know what cannabinoids to use, what type of terpene profile, what type of constitution needs this, what dose should they get. It's all very complex, and we don't have that historical data because it's been suppressed. It's literally, we haven't been able to use it or explore it. So we're just kind of tip of the iceberg here, figuring it all out. But we do have some guidelines, some guidebooks out there. So very complex chemistry. The female cannabis plant contains at least 113 cannabinoids, 142 phytocannabinoids in hemp so far, many terpenes, at least 20, many flavonoids, xenohormesis. Is this what we're talking about? I mean, the reason I bring that up is because I have a whole talk on xenohormesis, which is basically the stress of the ecosystem on a plant drives it to make a molecular signature. And that molecular signature, the molecules it creates to face that ecological pressure, whatever it is, the combination of them, is what the plant is made of. And that directs how those molecules are going to affect us. And xenohormesis says that a stressed plant is going to convert some of its stress adaptation through chemistry to whoever consumes it. And that's how an organism gains information about the ecosystem through the plants. So there's a very beautiful ecological connection happening. That's information sharing, that's preparing other organisms like us for changes that plants are sensing. It's really cool. But now with cannabis, we're playing with it so much. We're changing its ecological conditions. We're stressing it or not stressing it, or giving it light or giving it not light, or giving, and we're doing all these different things to it to change it more intentionally. But it's less connected to its real original sort of, earth ecosystem based relationship. And it's now kind of how we've been self-reflecting in a way through the plant. So is it xenohormesis? Sort of. There's definitely some hormesis there, meaning, conference of enhanced adaptive capacity. And CBD is really the thing for that. So endocannabinoids are eicosanoids. We're getting into this whole realm of the omega-3 fatty acids, or we're getting into the arachidonic acid pathway. And I just want to mention that, they're products of omega-3 and omega-6 fatty acids, eicosanoids are, and things that we know about that are eicosanoids are leukotrienes, prostaglandins, thromboxanes that are all involved in, different inflammatory pathways. Prostaglandins can be both protective and they can also be inflammatory inducing. The leukotrienes are clamping down blood vessels. So it has, a lot of effect. Eicosanoids are very physiologically affecting, and so are cannabinoids. So when we talk about cannabinoids, I want to just mention that whole plant extracts are very different than isolates or distillates of the cannabis plant. And what we've entered into right now is a pharmaceuticalization of the cannabis medicine. And what I really love about herbal medicine is that we find that complex mixtures of molecules, matrices, and plants lead to all kinds of gifts, really, of medical activities that we can't understand because the complexity of our bodies is such that we can't understand how it all works. And the plants, with their complexity, interact with our bodies in a complex way. And now we get this gentle enhancement of function through plant compound synergy. And I don't want to lose that. I still know in my heart that the best results are going to come from working with cannabis deeper and understanding it better and being able to work it so that it starts to do things that we want it to do. And it's so malleable. It's so unique in a number of ways. Like its light sensitivity is really unique to it. It's so light sensitive compared to other plants. And it's really a spirit medicine. It has a deep weave with our spiritual growth and evolution. And it's not for everyone, that's for sure, but it has incredible applications. And if we could work with it and start to really expand what we know about it and the different types of cannabis and how we change it by changing its ecological conditions, and then all the different, cultivars and chemotypes that we could select for, we're going to start to have a really nice treasure trove of medicines. And synergy is the key here, right? And we see that Like, for example, these studies showed that when you have cannabis extracts that are combination, that are whole plant, you get 2 to 4 times better effects than just the THC as an isolate. And we'll see also that synthetic THC, synthetic cannabinoids, are even less effective. Aromatic terpene compounds, right, play a role in the cannabis entourage. And that entourage word is one that's been used in the cannabis community a lot as far as describing how terpenes, flavonoids, and the group of cannabinoids all work together to create, a matrix that has an effect on the body. And that's very different from one combination of molecules to the next. Combined effect is greater than the sum of their effects. And that's really important. Here's our treasure trove, right? Cannabis may yet fulfill its potential as Machulam's professed pharmacological treasure trove. There's our cannabinoids, terpenes, and flavonoids. And then there's all kinds of other things going on too. This is the stuff called fridolin from the roots, cannaprine from the fan leaves, cannabicin from seed coats. And then there's canflavin A and B, really. And those are some of the main flavonoids that come from the plant. But all of these have beautiful benefits and, add to the entourage effect. So here's a look at the entourage effect, right? Biosynthesis, bioactivities, and then, of course, biotechnology can meet this with how we influence the plant to change what it does. And I'd rather influence the plants so that they create what we want rather than trying to extract the things that we want out of plants and then put them back together in sort of a Franken medicine, which is sort of like what we tend to do in pharmaceutical medicine and pharmaceuticalization. But the plant, if we work with it, it's so malleable, we can create the medicines that we want. So terpenes, I want to just jump into first because they're just a beautiful thing. We know a lot about them. We use them in all herbal medicine. They're such a big part of our plant molecule chemistry, all the synergy in the plants that we use. And they're potent physiological compounds. They affect behavior. They act on receptors and neurotransmitters. They're just great things. And you see here, I have linalool, caryophyllene, terpenine, eucalyptol, pinene, limonene, myrcene. These are all found in the cannabis plant, but also in other plants too. Like myrcene is a monoterpene. It's the most common terpene found in the hemp plant. It's also found in hops, and it's part of that calming effect of hops. And hops and cannabis have some really interesting similarities. There's a lot of beautiful overlap there. But other things you can see that have bits of myrcene in them. And what is known about myrcene in the cannabis plant is that it's extremely sedative and relaxing. So it's really good for insomnia and pain. It's just like sleepy and pain reducing anesthetic. And it's associated with the couch lock effect. And so people say, man, that's some really strong stuff. It's like, phew, people just like get mellow. That's the myrcene is a big part of that. And then pinene is kind of the other side of it. This is a bicyclic monoterpene, like you find it in pine and fir trees. It's very invigorating, very uplifting. It actually lessens the THC psychoactive effect. And it's used as an anti-cancer, component of Chinese medicines when you're working with cancer that way. And it's also just very uplifting to the mood. It's very focusing. Limonene from citrus and, the citrus plants in general is really good for uplifting the mood, for attitude. We'll see it's really good for nausea. It enhances absorption of nutrients, reduces THC side effects. And then you've got linalool, which is, one of the main terpenes in lavender. It's very floral, has that lavender smell, kind of a purple feeling, a purple kind of, experience when you smell it. It's so calming and sedating. It's good for sleep, reduces anxiety. And it's also upstream from parallel alcohol, which I know a lot of you know of as, in herbal medicine too, which has a lot of great benefits in the body. Some good stuff in there with cancer also that we've seen with parallel alcohol. So lots of potential downstream, metabolites from these that can also have lots of effects depending on how they're broken down in our body. Flavonoids, at least 20 of these in cannabis. Apigenin, like from chamomile, quercetin, from seeds, from the peels of fruits and vegetables like onions and apples. The canflavins, those are really, unique flavonoids are being studied. They come from cannabis plants. Beta-cytosterol, vitexin, all these amazing flavonoids. And we don't understand how this all plays together, but we're learning. So let's jump into what medical cannabis is used for. These are the conditions that you can get a card for today, depending on the state that you live in. Alzheimer's, ALS, HIV/AIDS, cancer, Crohn's disease, epilepsy and seizures. We're going to talk a bit about that. Glaucoma, multiple sclerosis and muscle spasm, severe and chronic pain, and severe nausea. So before we go into this, I want to just say that there's this biphasic action of cannabinoids. And it's really interesting because it's not a clear, just, parabolic curve where it's the same. Everybody's unique. you have this really unique dose specificity of cannabinoids because of the complexity of the endocannabinoid network. It's very complex and it's unique, and it's altered by all kinds of epigenetics and single nucleotide polymorphism changes in who we are as an organism. And you can use examples of alcohol and caffeine as well as cannabis and show that, some person, can just like take a little bit of cannabis and they're like, whoo, they're totally feeling it. They're like really out of their sorts. And someone else can just sit there and have a bunch of it and they don't really feel anything. Part of that's tolerance, but part of that is also just the fact that people respond really differently. Some people will just get a panic attack if they just take a little bit of cannabis. Some people are so sensitive, they even just get a tiny bit in their body and they're losing it. And then alcohol is the same way, right? We all have the same thing. Tolerance is there, but outside of tolerance, a little bit of alcohol, everybody gets more talkative and hey, we're happy. Then a lot of alcohol, where are you? You're just like, oh, I can't talk and I can't move. It's like, there's again, dose response. Caffeine's the same way, caffeine can be very uplifting and very focusing. And then at some dosing level, it's just like jittering and you're freaking out and you're ready to collapse. And some people, they drink a cup of coffee, they're down. It's just very interesting. There's a dose response to every person in every moment. So low doses of CBD, generally a little bit stimulating to the nervous system. Higher doses are generally sedating, and there's some dose ranges for you. The dose specificity is really important with this stuff, with all the cannabis medicine. So I'm just going to talk about CBD first, and this is like the most well-known compound now, and the one we have the most data on. It's got the best safety profile is CBD, and I'm going to use it as an example of cannabis medicine. We're going to talk about it a bit in this talk because it's really important. Here's some dosing for you. Starting dose, start low, dose frequency. Got to dose it frequently. A lot of times, just like with most herbs, they don't have a long half-life. It's got a relatively long half-life, but for its action, it needs to continually be dosed. If you're working on anxiety and trying to calm someone down with CBD, you're trying to work with pain, you've got to dose it frequently. That's really important. You can't just take it once a day and think it's going to cover you for the day. It doesn't work like that. It's like an herb. So oral CBD, best buccally absorbed. We'll look at that more. Combine it with fatty acids for better uptake. Really specific. Great for insomnia, anxiety, and depression, and inflammation and pain. That's where it really shines. So is CBD psychoactive? Well, CBD is psychoactive in the fact that it affects the mind or our behavior. Sure, it can be calming, it can be uplifting, it can calm anxiety, but it's different from THC. That it doesn't induce the euphoria, that feeling of intense excitement or happiness that happens with the right THC dose. It doesn't intoxicate a person. It's different. And so we need to kind of separate. It's not that they're all everything's psychoactive, but a lot of our herbs are psychoactive. Passiflora is psychoactive. We have a lot of psychoactive plants. Kava kava is psychoactive, but it doesn't mean that they're intoxicating. They're just affecting our nervous system. And then intoxication with the GABA receptor network, there's a lot of overlap into GABA as well as lots of networks, dopaminergic, serotonergic, but they're all woven in with the ECS. And so there's effects through all of those, but I was going to say that cerebellar sparing, THC and cannabinoids don't affect the cerebellum the same way that alcohol does. Alcohol really hits the GABA receptor hard and shuts it down. So it's inhibitory to signaling, and it does that in the cerebellum really strongly. That's why people lose their balance so quickly with a little bit of alcohol. That's where it's a little bit different with THC. So let's jump into CBD as the medical actions we know about today. Neuroprotection, big one. Anti-epileptic, also 2 drugs approved right now, right? Hypoxia and ischemia, it's got anxiolytic effects for anxiety. Anti-addiction, antipsychotic, analgesic, anti-inflammatory, anti-asthmatic, and anti-tumor. All of these things are documented parts of what CBD has been used to do in modern terms. So CBD's specific medical applications, great for pain, calm the nervous system, improve sleep, use it for TBI. It's great for TBI. All the TBI patients that I work with will always get a CBD dose. I'll always recommend that for them. Epileptic seizures, definitely. And you got to try a little bit with people because it doesn't always work the same. There's always this, with that homeostatic mechanism of the ECS, got to be a little bit careful. Some people do really well with things that some other people don't. Addiction, it's great for addiction. The CBD is. It's non-addictive itself. Neurological conditions like dementia and AD, and then Parkinson's, we'll talk about a little bit of variation there. But in inflammatory conditions like autoimmune diseases, it can also be really helpful. I find it really helpful in folks with autoimmune diseases, rheumatoid arthritis, psoriasis, SLE, you name it. There's a lot of people that benefit from CBD. When we look at what are the downsides of CBD, well, these studies that we're going to look at that, basically found CBD to be so effective in epileptic seizures, two different kinds, the Lennox-Gastaut and the Dravet syndromes. What they did is they used 10 to 20 milligram per kilogram doses for kids, right? 2 to 18-year-olds. And so that's, 550 to 1100 milligrams a day for 120-year-old, 120-pound people. And you can see here that the CBD groups had these type of effects, diarrhea in 19%, vomiting in 9%, decreased appetite with fatigue and paroxysm. These are all pretty small amounts. And that's big doses. Those are really big doses. I normally would not recommend doses in that realm for CBD. And I don't see people taking those doses very often. So what about herb drug interactions? Well, with cannabidiol, it is metabolized through CYP3A4, the main enzyme that we think of as a big breakdown for herbs and drugs and substances, and also CYP2C19. These are different parts of the cytochrome P450 system. And there are there's evidence of some interaction that happens, and we're not sure what all that is. But because CBD is a little bit of an inhibitor of CYP3A4, if people are taking high doses of CBD, you need to be a little bit cautious with people. There's some variable results in the data. It's not really that clear, but they did show there was a study with valproate and using CBD, and a certain population of that study group did get some transaminases, liver enzyme elevations. So again, big doses, be a little careful and monitor people. But lower doses, there's really been no issues so far in the data. So CBD versus THC, very different effects, right? CBD has effects which are basically opposite of THC, and CBD will ameliorate the intoxicating effects of THC, which is really beautiful. That's why it's great to have them together. It doesn't push the heart rate or the blood pressure, but in animal models of stress, it can actually reduce the heart rate and blood pressure. Whereas with THC, sometimes, depending on the dose, you can get actually rapid heart rate. You could get other physiological alterations, anxiety, things like that can come out of THC. Of course, if the dose is right and the combination is right, you're going to get the best effect. So CBD pharmacokinetics, really low or oral availability. So you can enhance that a little bit. You can use, fatty acids, take it with a meal. A good fatty meal is going to be really helpful. I always recommend people take it with a little bit of black pepper, the bioperine, which is so good at pulling things in. Probably MSM is also good as a good kind of, changes the metabolic terrain a little bit, so things are absorbed a little bit more easily. But you're trying to get things, try to get this to be more bioavailable so you don't need as much. But the best way to get past all that is just to take it orally and do a sublingual type of an application where it can be absorbed through the mouth, because that first pass metabolism, the phase 1 in the liver, really takes apart the CBD pretty quickly. It's a very complex, there's lots of metabolites, but it basically means that, we don't get a lot of CBD into the bloodstream. Once it goes through the digestion, goes up through the mesenteric venous system, goes up into the hepatic portal vein of the liver and gets broken down. That process, it doesn't do very well in there. So if we can bypass that, topicals, oral, smoking or inhaling or vaporizing, those are all ways to get it in where you can skip that whole process. It doesn't mean that process doesn't work. It just means you have to use higher doses and you got to combine it with the fats and the pepper, other things to get it to work better. So epilepsy is the first, really big kind of success story we've seen with CBD in the research, right? Animal studies back in the 70s showed that there was lots of different nervous system action, addresses seizures and comorbid conditions, things that go along with it, like depression, beneficial effects in a bunch of different neurological disorders. And the preclinical studies show that there's a lot of anti-epileptic activity going on. And that was kind of the build up to, what was going to happen with this work in kids with epilepsy. And we're going to look at those studies next. And I'll just go ahead and jump to them because I should probably put this right here, this is the study that kind of showed that CBD really does a great job with these two different subsets of childhood epilepsy, Lennox-Gastaut and Dravet syndromes. And the research is really compelling that kids did really well when they took these agents for their different types of epilepsy. And so now there's drug approval of using CBD, and this is Epidiolex is the medication for Lennox-Gastaut and Dravet syndromes. But just because there's a pharmaceutical medication doesn't mean that you can't use the CBD coming from plants. As we'll see, though, you just need to make sure that the material is what it's supposed to be. Make sure that the manufacturing is good and the testing is right, and so you're getting the right medicine. I was going to jump back here real quick. Just do this. So adult epilepsy is a little different. They're represented in most CBD trials, right? You get things like post-stroke epilepsy, traumatic brain injury, things that just haven't really been represented, but probably a lot of people would benefit from the use of CBD in those contexts. THC is a little more risky because when we get into depression and psychosis and suicide, THC has to be really carefully used and monitored because it can actually aggravate some of those things, especially the psychosis part of it. But in adult epilepsy, we'll probably see that CBD is really beneficial. So here's some dosing stuff for seizures. Starting dose, 2.5 milligrams per kilogram. That's what they started with. That's pretty big. So if you had if you had a 120-pound person as your average, for a younger person, for an adult, let's say that it was 150 pounds. You've got to take that, cut it in half, basically. So you're going to be at somewhere around 200 milligrams twice daily. That's a pretty big dose of CBD. These are big doses. For most conditions, we don't need that high of a dose. But you can see they pushed up to a maintenance dose of 10 milligrams, right, twice daily after the first week. And sometimes they went up as high as 20 milligrams twice a day. But when you get into those higher doses, you start getting a little bit more of those side effects that we saw, like sleepiness, diarrhea, fatigue, or low appetite. And I've seen those even in lower doses, but very rarely. So when we think about psychosis, and this mind-altering effect of cannabinoids, I want to just talk about CBD and the anandamide and what they do in psychosis because they're really helpful, okay? Anandamide regulates pain, mood, and cognition. And when you block the breakdown of anandamide, which is how CBD acts, one of the ways at least, in the ECS, the endocannabinoid system, that's really powerful because it's going to make anandamide stay around longer and do more of what it does, which is it responds to any kind of stress in the neurological network and calms it down and helps to repair it. That's what anandamide is used for in our bodies. So CBD does that, again, partially by inhibiting that enzyme, FAAH, that we talked about. It's effective at improving psychotic symptoms. It's as effective as amisulpride with very few side effects. That's really important. It's a very safe medicine, right? Back to our Hippocratic oath. Do no harm. First, use a medicine that works and doesn't hurt anybody. That's why we should be pushing this medicine, to be more available to patients and people who need it. Marks tolerability and safety. And you can compare it with lots of current medications and find that that is the case. Cannabidiol enhances anandamide signaling, alleviates psychotic symptoms of schizophrenia. Really important. THC is not the same. We don't want to be using THC if we're a person who has schizophrenia and we're looking for something to help us because it can actually aggravate the psychotic aspect of it. It can cause even more schizophrenia, make it worse. Thankfully, even though people at some point were saying, oh man, if you take high doses of cannabidiol, CBD, you're going to end up, getting all these THC-like effects, or you're going to, in the gut, convert CBD to THC. There was a bunch of kind of scare about that, some years back. But this study came out not long ago. This was 2016, and said, hey, you know what? High doses of CBD don't cause THC-like effects. Like I said, actually has opposite effects, and it actually ameliorates some of the negative side effects of THC. So I'm going to give you some dosage ranges for CBD for different conditions, okay? For pain, 25 to 100 milligrams. That's from the journal Pharmacy. Neuropathic pain, when it's a little bit more intractable, 50 to 250 milligrams a day. Journal Pain Medicine. Insomnia, pretty big range there, 20 to 160 milligrams. That's from the Mayo Clinic. My personal experience with that is that a lot of times you've got to get over that dose response curve because that lower dose can be a little stimulating. So people need to go. Sometimes they say, I take CBD, it doesn't help. We'll try a little more, and a lot of times people will go a little higher and they'll find that they do better. Sometimes people need that 160 milligrams right before bed. Some people need 100 milligrams before bed, and that will really get them sleeping. And they don't get much grogginess once in a while, but sometimes people can even wake, if they wake in the night, 3 or 4 hours later after that kind of peak, 3 to 5 hour peak of CBD is over, people will then be able to take another dose and go sleep for another 4 hours. Epileptic seizures, like we said, Mayo says 200 to 300 milligrams for 4 to 5 months. Like we saw, some of those, studies in kids at least were much higher than that, 500 to 1,000 milligrams. Huntington's chorea, pretty big dose there. Alzheimer's disease, for what I've seen is that 100 to 300 milligrams is really a good place to be. And that's from a lot of other colleagues too, have been watching people who are taking CBD and finding good results in that 100 to 300 milligram per day range for multiple sclerosis. And we'll see there's some research on a product called Sativex, which is another drug approval that's shown some good results in spasticity with a mixture of cannabinoids. But even just CBD at 200 to 400 milligrams a day can be really helpful in reducing spasms, reducing a lot of the symptoms of MS. Especially with the anxiety, insomnia, pain, can help with all of that. Parkinson's, you have to be a little bit cautious because you can have a paradoxical effect in some people. Some people it works really well for 100 to 300 milligrams per day. Cancer, generally, folks have been using 500 to 800 milligrams per day, combining it with other therapies. As you know, I thought as we get into the kind of a little bit more on THC, we'll see that there's a lot that goes on kind of in that realm of sort of Rick Simpson and sort of what this dose of THC is supposed to be for cancer. And so there's these combinations that get kind of these higher doses. But as we'll see, there's a lot of specificity there and we got to be careful with it. But dose escalation to reach 500 to 800 milligrams, that's often really helpful. And if people are already doing other therapies, aside from immunotherapy, which we'll see, I don't want to recommend it during that, but if people are doing other things, like radiation, for example, it can be really helpful in that dosage range. And radiation therapy, there's some good research there, some animal studies that showed that, especially in brain tumors, which is where I find cannabinoids are really helpful in cancer, is in brain tumors like gliomas and oligodendric gliomas, astrocytomas. They're really helpful in that realm. But the rest of the body, it's a little bit less well known. It's a little bit more mysterious. What's the best way to go? But a gram per day of CBD-rich extract, equivalent to 600 milligrams of CBD, that came from a number of colleagues who were saying that people had been doing really well with that. And that was based on this earlier animal research. And that's something that I think is a really good recommendation. Radiation synergy, helping the radiation work better without causing more damage to the person. No significant central nervous system side effects or effects on vital signs or mood have been seen at doses of CBD up to 1,500 milligrams a day, right? That's a pretty big dose. It's a really big dose. And co-administration of CBD and opioids was safe and well tolerated. That's really important because one of the things that's been a big boon in the cannabis realm, and especially with CBD, has been its ability to help people that are addicted to opioids, that are having opioids suppressing their immune system, that are having opioids interfere with their life, are able to move to some cannabinoids and reduce their dose of opioids. That's really important. And I'm not saying anything. I think opioids, that's it's its own medicine, and so is cannabinoid. But although we have such a big opioid epidemic right now, that this is a great opportunity for people. So THC, delta-9 tetrahydrocannabinol, this is a psychoactive molecule. Like I said, it's intoxicating and euphoric. It's lipophilic. It's an agonist at the CB1 and CB2 receptors, right? Very much so on the CB1 in the nervous system. It has effects on thinking, memory, pleasure, coordination, and movement, and all those things we talked about earlier because it's activating the ECS system. CBD is altering the endogenous cannabinoids, right? Well, THC is acting on the receptors and causing them to do what the downstream transcription tells the cell to do. So,
Ethan, I'm so sorry to interrupt.
Oh, yeah.
For some reason on our end, the slide stopped moving forward. Oh, there we go. It looks like we're back in action. Thank you.
Must be something on Zoom.
Definitely, yeah, because all of a sudden it just hopped. I will, in case it happens again, I'll definitely let you know, but sorry to interrupt.
No problem. Thank you. Yeah, Raphael Mechoulam in Israel in 1964, he's one who first isolated THC. And this is what it was found, that when it was smoked, it went through the bloodstream, traveled to the brain, had all these effects, on the ECS. And it just kind of started this avalanche of realization of the ECS and the molecule and then all the studies, and it kind of just went on and on. But it started back in 1964, and THC has been really one of the focuses. And so I was just going to say that the study in 1972, they gave up to 9 grams per kilogram of THC to dogs and monkeys with no lethal effects. So even though it can have some really interesting effects on the mind and can be challenging in some ways, it still has a lot of health benefits, and it also is very safe, especially compared to a lot of these other medications out there. So this is more cannabinoids with looking at the two of them, THC and CBD, different times, right? So you're taking in the cannabinoid on the left, and that's what's happening over time. you can see that the triangle is CBD, and you can see the THC is the square, mean plasma concentration, right? So this is an oral mucosal dose. This is in the mouth where you're absorbing it through the buccal membranes, okay? So the same dose, you get a little bit higher of a peak of THC. It's a little bit better absorbed there, but you can see both of them over time, it's slowly, their dose effect is peaking at that 3-hour point, and then it's slowly dropping off over the next several hours. So I mentioned THC and psychosis, and because it's an agonist, because THC is an agonist at those receptors, the CB receptors, it can push the body to do things, and it can push psychosis in an unhealthy way. It can hyperactivate the endocannabinoid system. So we just want to make sure we're careful with that. And so, if people are saying, hey, I've got a psychotic, issue, bipolar, mania, you've got schizophrenia, you just, you can tell them, hey, don't try THC rich cannabis on your own. It's not a good idea. So, and I also want to mention that with THC, part of this talk was about what cannabinoids can do and what they can't do. And one of the things that they don't do very well is work with the developing brain. And I should say specifically, CBD, I don't worry about with kids. It's not a problem for me. And if kids can use that medicine for epilepsy, for anxiety, for insomnia, for calming themselves down, for enhancing their focus, all the great things that it does with the brain, if they have TBIs, whatever, they should use it. But with THC in the maturing brain, we can see that there's some alterations in structure and function that can happen, and that the effects during adolescence might be more serious on the brain. And it's so plastic and so shapeable. We don't know for sure. I know that a lot of myself and friends, we experimented with THC in our childhood. I think we came out okay. I don't know. Maybe maybe I could be a lot. I don't know. Anyway, but so the story is just that, I always recommend that kids and parents are asking about their kids that, CBD is one thing, THC is another thing. And so kids are going to be doing THC. They are, I know that. So just, make sure they're doing it with CBD. That's really the key, and keep it to a minimum. Take big breaks from it. Don't make it an everyday thing. Don't let it shape your brain in a way that you don't understand. So because we're talking about THC and its kind of potential negative effects, I don't know about you, but one of the worst experiences I've had in my life with any chemical is THC. Like an edible or something that somebody gave me. I've had 2 experiences that were really profound when I got overdosed. And man, I'll tell you, all these things. I had all these things. I basically just went to a place of, I am the worst human being. Everything I've done is terrible. I've just ruined so many things, and my heart's beating, and I'm just sitting there like, okay, this is going to end at some point, right? Okay. Terrible experience. And I didn't know how to get myself out of that. And so when people are working with THC, it's really important that they work with a dose that's small to start with, little bits of doses, and then build up, because there's a tolerance mentally, especially on the mental cognitive level, there's a tolerance that gets built up over time. And so, people need to know that. And if you start with too big of a dose, you can get all this stuff. Now, I did build a formula that's really good to help with THC overdose. And these are herbs that are well researched, compounds that have a lot of data on them, showing that they help to calm THC overdose. And the Acorus calamus at the top is the number one. That's from India, where cannabis has been used for centuries and centuries. And Acorus calamus is considered an antidote for that overdose, and it works really, really well. If you take a tincture, like 2 droppers of just straight Acorus, it tastes terrible, but 2 to 3 droppers dosed, every couple hours as needed, every hour, until the person kind of comes down from that experience, it works really well. It's a nice thing to have. I've actually sold Acorus calamus to, cannabis dispensaries so they could have it for their medical card patients. Other things here, the linalool, like I mentioned, great for kind of, down regulating. I didn't put CBD on here. It's kind of mild in that way. The other one is also COX-2 inhibitors. The NSAIDs can be helpful too. If people are taking Advil or acetaminophen, naproxen, they can also be helpful to kind of pull down some of that THC over hyperactivation of the ECS. I mentioned Delta-8 THC, and I only mentioned it because it's so popular right now, because you can get it out of CBD plants. So it's being pumped out into the market as something that can get you high. Is it legal? It's part of the Farm Bill. It's derived from CBD isolate. They isolate the CBD and they break it down to Delta-8 THC, which means it's very highly processed. They use more solvents. There's more toxicity. They did find it in a burial tomb back in the 4th century because it's really stable. It's a breakdown product, so it kind of sits there for a long period of time. But there's only trace amounts of it in the plants, so it's like you're really having to extract a lot of plants to get a little bit of the material, and it doesn't work as well in its mood altering effects as delta 9 does. So let's jump into THC for glaucoma, because it's been known for a long time, at least 50 years, that cannabis, especially THC, can reduce IOP. And this is IOP, of course, is the big backdrop for glaucoma, the open angle and closed angle glaucomas, which are the major cause of blindness in the world. And so using THC can be really helpful. It just has to be dosed really frequently, but it can be used as another treatment for intraocular pressure elevations and the underlying cause of glaucoma. And it was interesting because with CBD, it's so calming to the nervous system and kind of helps people relax. I thought that would be helpful for this condition as well. But when I did the data digging, it shows that in a number of studies, the CBD can interfere with the THC IOP lowering effects. And so it's better to use a higher THC substance, whether it's oral mucosal or people vaporizing it, what they're doing to start to reduce the glaucoma symptoms. Of course, you have to be monitored by your ophthalmologist to make sure your IOP is in the place you want to be. If you were a patient and you chose that, you just have to discuss it with your doctor and make sure it's working for you. Otherwise, you should use the drops they recommend, because again, the risk of glaucoma and blindness is very real. So how much cannabis can you take with other medications? Well, it's case specific. And like I said before, the low doses of CBD are probably not problematic, but when you get into those high doses, we probably do need some monitoring. And this slide could have been back with the other one earlier, but you got to evaluate people if they're using drugs that are really heavily metabolized by CYP3A4. And there's a lot of those. Just you can find it really quick on PubMed, or just go to the internet and say, hey, drugs metabolized by CYP3A4. Oh, my patient's on this drug, that drug. And then just if it's a drug that's highly metabolized by that enzyme pathway, and the person is using high doses or wants to, you could help them understand that relationship and say, hey, you're going to have to be a little careful because you're using high doses of a cannabinoid, which could interfere. And just for the dosage ranges, THC for a person who is, let's say, THC sensitive, a 5 milligram dose of THC is enough to get you feeling that, whoa, like I'm pretty intoxicated. Some people can take 100 milligrams and not feel anything. I've seen lots of patients that came to my door saying, hey, I'm taking THC for cannabis. I'm taking a gram a day, which is 600 milligrams of THC. I'm like, wow, they've built up to that. There's a huge tolerance that gets established over time. I wanted to mention Sativex. I mentioned it earlier, and just going to look at it in the Biximols. This is a mixture of cannabis sativa molecules, the CBD and THC. It got approved for the treatment of neuropathic pain and for multiple sclerosis in Canada. So it kind of just shows that for those spasticity type of conditions, it could be good for ALS as well. But that would be inferred. But the Sativex spray does a nice job of that. You can see what's here is that each spray, right? Well, I guess, 2 sprays would be 27 milligrams of THC and 25 milligrams of cannabidiol. It's a 1-to-1 extract, right? So this is just one spray. One spray equals 2.7 milligrams of THC and 2.5 milligrams of CBD. So that's per spray. So dosing is, low to start, and then it can be built up depending on how people responded. But we saw that there was some nice removal of spasticity, relief from spasticity in patients with MS with this formula. Some of the drug-to-drug interactions that were discovered with this, these are CYP3A4, regulated drugs, ketoconazole. It had a definite effect on the THC amount that was used, that was in the body. Rifampicin also. There's an overlap between those two. And sometimes the drug increases the power of the THC, right? I want to mention PPAR receptors, peroxisome proliferator activator receptors, because they're really a big part of the blood sugar insulin thing that we have going on in this culture. And CBD activates PPAR gamma receptors. It does a nice job of activating them, and which can lead to a number of different effects, like influencing inflammation and also enhancing insulin sensitivity. And because a lot of diabetics get on medications like the thiazolidinediones, like the TZDs, these PPAR-specific drugs, there's a lot of side effects that come with them. And if we had other options, like, for example, CBD or a combination of cannabinoids, we could affect all these wonderful areas without the side effect profile that people are facing with the drugs and medications they're taking. You can see here just a lot of the things: insulin sensitization, glucose-stimulated insulin secretion from the pancreas, gluconeogenesis, that's, this glycogen storage system, increased adipogenesis, increased lipid metabolism, increased glucose. The red side of it is when it's low, right? When the PPAR is low, you get the heart changes, kidney changes, the bones change, brain changes. When in the green areas, when PPAR is activated above, you can see all those things in green arrows get better. Increase in bone remodeling, increase in adipogenesis, and lipid metabolism goes up. So lots of good things happen with PPAR activation. And a lot of our other herbs do that too. We've got a lot of herbs in our toolbox that do that. So I'm going to jump into the cannabis and the immune system, because this is another topic that's really important and really hot. It's clear that many of the components of the ECS function as key regulators of the immune system, okay? And regulating is really the important component here. It regulates, because the ECS is a homeostatic regulating network. It regulates. And so when we do things like we add, cannabinoids, we're regulating, we're helping the body regulate, but we're not pushing it one way or the other too hard. It's just that sometimes when we do this, we can actually start to interfere with immune function, and we don't always know it's the right thing to do, even though in some cases, like autoimmune disease, it can be really helpful. Blocks the progression of arthritis in a murine collagen-induced arthritis model. That's mice. Activation of CB2 attenuates synovitis and joint destruction in collagen-induced arthritis in mice. Beneficial effects for treatments that include FAH inhibitors, and it includes osteoarthritis and rheumatoid arthritis. In RA, there's a 58-person double-blinded randomized trial, and they had an analgesic effect with Sativex. That's another place that Sativex has shown success, right? There's a combination of CBD and THC together. Different in infectious disease. Some of the research in infectious disease shows that people have a harder time getting over viruses or bacterial infections, and some say that they do better. I'd say that with that regulatory, you probably are going to benefit people. They're not going to get into an out of control immune state, but it might actually lengthen the course of their disease. They might have reduction in symptoms, might feel better. It's hard to say. But in murine models, the effects of THC high cannabis extract and CBD high cannabis extract on inflammation were not significantly different, meaning that both of these compounds can reduce inflammation pretty powerfully. So let's go ahead and we're going to jump into the oncology part of it, because, the immune system is a huge piece of oncological, outcomes. More and more so, we're learning this all the time as immunotherapy becomes one of the key components in cancer therapy. So I mentioned Rick Simpson, who was an engineer working in a Canadian hospital in 1997, who, he had some mysterious bumps on his arm. He had tried cannabis previously for a traumatic brain injury type thing he had. He fell off a ladder and had, kind of really great results taking cannabis. And so he basically designed this oil where he'd take like a pound of dried cannabis material, and he would put it in 2 gallons of solvent, mix it up, and also isopropyl alcohol. Then he would, drain that off, put it into like a rice cooker, simmer it for a while, decarboxylate it, and then have this oil. And it got dubbed Rick Simpson oil. And he, his claim was that he had basal cell carcinoma. He had these bumps on his skin, and that after a few days of applying his RSO, he cured his skin cancer. Well, the sad thing is that people, and I've had dozens of people from starting back 8 years ago come to me saying, hey, I'm going to cure my cancer with Rick Simpson oil. And I'm going, what kind of cancer do you have? You have breast cancer, metastatic? Oh, you have leukemia? Oh, you're going to cure it with Rick Simpson oil? Okay, well, have you talked to your oncologist about that? Because I don't know anything about this. And as I learned over time, I saw that, I didn't see people having the kind of effects that they were wanting. And I did watch many people die trying to use cannabinoids, THC-rich RSO, to treat their cancer. And my advice was always like, well, if you're going to do it, don't, avoid the other stuff. Do whatever you can. Obviously you're already in a stage 4 disease state, so you're incurable in terms of chemotherapy, radiation, what other options you have. It's an incurable condition. So you're looking for any kind of possibility. But in that state, doing cannabinoids is probably a decent idea. Most of the studies that we've shown have kind of mixed results, but it doesn't make you worse. And oftentimes it can really help with symptoms. And that's really where, cannabinoids shine, is for symptom management. But if you're trying to cure your cancer with Rick Simpson oil, I think it's pretty misguided, especially based on the fact that basal cell carcinoma is a very different thing than any other malignant invasive carcinomas and soft tissue tumors or hematological cancers that we deal with. So I want to mention Christian Lay. He's a medical doctor. He was one of the guys who I talked to early on looking into cancer and cannabis. And he had a patient who was a pancreatic cancer patient that, he had gotten in touch with and was his medical doctor. And this guy was taking THC, and he has pancreatic cancer, which was, running him to early death, and he was just feeling terrible. He ended up doing really well and lived for several years just doing this RSO. And it was like really profound for Christian, and it changed his life. Dr. Lay started to really focus in on cannabis, and I kind of crossed paths with him. And it's one of the stories that inspired me that there's something there for sure. There's something going on here. And again, I think there's a lot to finding the right person constitutionally, the right cancer, then fit the right profile of all the things we talked about, the cannabinoids, the terpenes, the flavonoids, that would be directly active on that person's cancer. And that's the trick. We're not there yet. I have a certain feeling about cannabis in brain tumors. And like I said before, it's the place I feel the most confident that people could get benefit using high THC and CBD combination oil extracts for cancer in brain tumors. And I have a patient, Jason, who came to me with a grade 3 oligodendroglioma. It's a very aggressive form of brain cancer. And he had been doing surgery, radiation, chemotherapy, steroids. He did all of that for the 2 years prior to me meeting him. And in January of 2008, he was put on hospice. He came to me in February and he said, "Hey, I'm going to do this thing with cannabis. What do you know about it? And is there anything else I can do?" And I said, "Well, I've seen a lot of great data. There's some really interesting things. I've heard some case studies about brain cancer. I think you should go for it with, you're doing your THC thing." And I put him in touch with a person who was a caregiver who got him a really good source, and they worked together on the THC CBD side of it. And I got him on a ketogenic diet, which I think is also really important in brain tumors, at least most of them. And then I also got him on a nice botanical protocol, lots of, all these different botanicals. If you take a look at my intensive from Friday, you'll see it's a 5-hour download on using plants and different methods to help control cancer in lots of different ways. And you can do that in combination. And, amazingly, he came out of hospice over the next 3 months. He slowly was able to taper off of his steroid. And now he's living the life. He's just doing great. I went out and visited him not long ago, 3.5 years from his hospice, situation, and he's doing great. So I know that there's something to all of this. I'm just not sure when is the best time to use it and when isn't. So seems to be a dualistic role to the CB receptors. Some studies show that there's high upregulation of the endocannabinoid system shows more aggressive tumors. Others show that that's tumor suppressive. So experimental studies show that there's oftentimes an anti-tumorigenic effect, but not always, right? And this gets down to that metabolic phenotype of cancer and how we can identify that. And there's some ways to do that. Again, that's all from my lecture on Friday. Cannabinoids can effectively modulate tumor growth. However, it's dependent on cancer type and drug dose concentration, right? We don't have that data yet. Okay. The palliative care role of cannabinoids is much more well established, alleviating pain, relieving nausea, stimulating appetite. Really, really wonderful in this regard. And one of the best medicines we have for this type of condition. People in cancer care can benefit a lot. So again, the things that are important, the cannabis profile, what's the metabolic phenotype, the physiology of the person, and then what kind of cannabis are we using? What's the actual medicine? And how does it fit those things? How do we understand all of that? Some of the places that cannabis is really great in cancer, nausea and vomiting, number one, so good, and loss of appetite. Nothing does a better job than cannabis. And as I'll show you, vaporized fresh cannabis is the number one. And I'll give you the details on how to do that. Cancer-related pain, inflammation, some anti-cancer effects, like I said, in some cancers, anxiolytic effects, down-regulating the beta-adrenergic system, which of course, that's a big driver of cancer. So if you can calm people's nervous systems down, you're doing them a big favor. Therapies work better when nervous systems are calm. Cancer and the immune system is better for people when the immune system is calm. People can reduce opioids, which are heavily immune suppressive. You get rid of side effects of drugs. There could be potentiation. There could be drug synergy. We're going to learn a lot more about it, but be careful of interactions as well. So radiation in glioma was one of those things that, there was this study that was done back in 2014, showed that in mice that these, tumors on the final day of the study were a lot smaller in the cohort of animals that got the radiation plus the cannabinoids. And so it was like, whoa, something happened here. There was a radiosensitizing effect. And that radiosensitizing effect is one that I think is really important. And I think we should, capitalize on. I'll give you some more dosing ideas about that down the road. And you saw that slide I put up earlier. It had the radiation dose in it. That's the dose that, would be co-evolve with this study and being able to help people make decisions about using cannabinoids with radiation. I think CBD and radiation is a great idea. And I have a number of patients that have chosen that path and have done really well. All of them. I've never seen it do anything negative to anyone. So synthetic cannabinoids, there's dronabinol, the Marinol, right? It's been approved for a long time for use, in nausea and vomiting caused by cancer chemotherapy. And then there's nabilone. These just don't work anywhere near as well as the whole plant extracts do. Cannabinoids from the phytocannabinoid, they just works so much better. I've just never seen these drugs do much for anyone. That's just my personal experience. So should we give cannabis with immunotherapy? Well, interestingly, I've been avoiding it because I keep getting these whispers that we don't know. With immunotherapy, there's a chance it can be really effective in some cancers, especially people with metastatic disease. So I don't really want to mess with it. So if people want to use little bits of, CBD, that seems like it's okay. But I think that we have to be really careful. Look at this, immunotherapy correlates with poor outcome in cancer patients using it, right? The effect of concomitant cannabinoids in this study showed that non-cannabis users, this was retrospective, had significantly longer survival compared to non-cannabis users, 40 months versus 16 months. That's substantial. So there, not that all the data is bad, but just there's enough that says that there's this immunosuppressive effect of cannabinoids. That's why I said it's really great in autoimmune disease, great in inflammation, but that inflammation signals immune activity, right? So this is where we get into this thing where it's like, man, I don't know. I don't think that we know enough about it. In this study right here, 37.5% response rate in nivolumab, that's the immunotherapy, compared to 15.9% in the nivolumab plus cannabis group. There was no change in the overall survival or the progression-free survival, although they got an initial response that was better in just the nivolumab. So again, we don't really know. Maybe there's something good happening here, but I'm just really cautious when the data is this, all over the place. I mentioned CBD for anxiety. I think it's the number one application of that agent. It's really great. People with social anxiety disorder. There was a study done on the 9/11 attack and the PTSD experienced by people that worked in the World Trade Center afterwards or who were in it. And what they showed is that those people had significantly lower anandamide levels than normal subjects with no history of PTSD. And then it was shown that CBD has antipsychotic properties. We know that. So then it was shown that people that had this PTSD could take CBD and do really well. And some of the things that we see in the data, right? Anti-inflammatory actions, neuroinflammatory calming, promoting neurogenesis, reverses and prevents the development of cognitive deficits in Alzheimer's dementia rodent models, and can antagonize the psychoactive effects associated with THC, and it could do better job than either one alone if you combine the two together. And oftentimes CBD with just a little bit of THC, like those 31 extracts, it's mostly that's the hemp from the Farm Bill stuff, that does great in people for this. So traumatic brain injury, CBD is amazing. It does really great. As I said before, reduces brain edema, helps clinical recovery, reduces infarct time. And what's so interesting is that when traumatic brain injury happens, there's all these harmful mediators that get released in the brain that lead to secondary damage. When scientists analyze people who have had TBI, they see that they upregulate their endocannabinoids. Endocannabinoids are released as part of the repair mechanism to injury. So if you can enhance endogenous cannabinoid manufacture, receptor efficiency, and reduce their breakdown, you're going to get better recovery in people. And that's where we can see that it's just such a powerful, treatment for people. Reduces brain damage, improves functional recovery in animal models of stroke and TBI. How many people suffer from stroke, that deficit afterwards? It's really powerful there for helping people. Limits the size of damaged tissue when administered after a closed head injury. Really amazing. Also in CTE, chronic traumatic encephalopathy, with people with accumulated concussions. And that's really what we're seeing the research now, in contact sports, football, hockey, and things, people really starting to see that cannabinoids are a much better option for them than opiates. And they not only can help with the pain, but they also can help them with the traumatic brain injury repair. And this is a study in hockey that was proposed in 2019. I think it's ongoing right now. I tried to find out if it was done. It's still not done yet, but it was 100 former pro hockey players who obviously had that, concussive injuries over a long period of time. And they had all these symptoms, headaches, emotional instability, PTSD, et cetera. And they were going to look at these people over the course of a year. As soon as the study comes out, I'll get that information and share it with you guys. But I think we're going to see some really positive things. So CBD dosing for neuroprotection, 10 to 20 milligrams. I showed this before. Dose frequency, 3 to 4 times a day. And upper end is 300 to 500 milligrams. So it can go pretty high. Again, watch for any kinds of those side effects, and, build up gradually. Make sure it's a good extract that has good terpenes and flavonoids in it. Just to clarify, the WHO came out, the World Health Organization says that CBD has no indicative effects of abuse or dependence, right? It's been demonstrated as an effective treatment in several clinical trials. Epidiolex now approved for those epilepsy syndromes. No evidence of recreational use of CBD. And CBD can be converted to THC in experimental conditions. This was something that was being proposed, like I said, but it's not happening. We're not seeing that. And the WHO accepts that. I like to use CBD in combination with other agents for calming the nervous system. I combine it with kava and skullcap for stimulation for these lower doses. Again, when you want to calm the nervous system, use higher doses. A lot of folks that I work with will do 50 milligrams of CBD, 4 times a day, especially if they've got anxiety, heart palpitations, and insomnia. Combine it with kava and Scutellaria latifolia and all the other great herbs, the ziziphus, the magnolia, the verbena, you name it. They're all going to help, and you can use them together. You'll get a really calming effect. And then a lower dose of CBD, that 10 to 20 milligram dose 3 or 4 times a day with rhodiola, with gynostemma, you'll start to see that people get a nice energy lift and a focus enhancement. And for pain relief, you can also combine it with methylsalicylates. You can combine it with white willow, combine it with corydalis. They'll all be helpful. And like I said before, the pain quieting enhancement is synergistic. So we talked about Rick Simpson, but I want to just mention the form of cannabis that most people use these days is a cannabinoid oil. And you can use it orally, extract it, the buccal, or you can take it, and put it in a little capsule and take it in your mouth and swallow it. But then you get, a lot less absorption. Absorption here is much higher. Maybe it's high 30%, where it's like 6 to 10% in the gut. CO2, very clean. You lose some terpenes and flavonoids, but you get a really nice product, like 60% CBD. Ethanol, it's also really clean, and you get you get rid of all the solvent. Butane and naphthalene, again, a little bit of solvent left over there, not a good idea, but high potency. Ethanol does a great job. It gets a little bit more of the chlorophyll, gets a little bit more of all the other components. I think CO2 and ethanol are pretty comparable to myself, but even ethanol extracts might be even a little bit more full spectrum. Dry ice can be used. Mechanical pressure is a really interesting one. It's just kind of being used, but these really big presses that just kind of press it, and there's a heat and the compression, and you can extract the oil from it that way. And it kind of this is a nice way to go. I think we'll find that's a really nice way to go also. And then there's tinctures, oils, and glycerin that all work really well also to different potencies. But this is what you see on the left there, that kind of that cannabis oil, that's the most potent form that we generally use, unless you're getting into distillates and isolates. But this is the CO2 extract that's got a little bit of the terpenes, some of the flavonoids, and so it's got a lot of that beneficial effect. You see a lot of this liposomal formulations where that you basically have encapsulated the cannabinoid inside of this liposome, and it's done generally through this sonication, where you sonicate with hypersonic vibrations, and then all of a sudden the thing organizes with a little bit of ethanol, some glycerin, some water, will organize into these little liposomes. And then the idea is that it's highly absorbable. It is, but I haven't seen the data to show that it's really outpacing, if you took just the nice extract and you put it with the black pepper, you put it with the fatty acids, and you took it orally, you'd still get decent absorption. And you can also do buccal. Those lipids will go in the buccal membranes really fast. It may be that liposomal is somewhat better, but it can be a lot more expensive, and it's not a natural form. So just to talk about pain, pain is a sensory, emotional, and cognitive experience. Basically, it's, we're having an experience, we're experiencing something as sensation, and whether it's pain or not is different. One person can experience the same amount of input as pain. Someone else just feels it as an irritation. Someone else feels it as, it doesn't really bother me. So when we play with that, when we alter that, we can change the pain experience, even if we didn't actually block the nerve impulse. Okay. And so what's interesting about the cannabinoids is they work on this level to alter the pain experience, and altering the pain experience can be really powerful. And when we think about our main pain medication these days, opioids, the CBD is very safe with opioids, and so is the THC also. But this is a great study when you administer concomitantly with fentanyl, and fentanyl is a very, very potent opiate, right? Extremely powerful, and it was safe to combine with CBD. That would mean that you could get a lower dose of the fentanyl and use CBD. The terpene profiles for pain, this is the one: the linalool, myrcene, limonene, beta-caryophyllene, and alpha-pinene. So when we're talking about what's going to work best for my pain, the linalool and the myrcene is really good, really analgesic. So Those are kind of like the indicas. They have those really rich, thick, flat, flavors and smells. They do a great job of like helping with the analgesic quality, but they're also kind of sedating. So if you have some limonene and some beta caryophyllene in there, it'll be a little more uplifting, some pinene. So a nice combination there will give us the best pain relief. For sleep, it's the myrcene and linalool and also terpinolene. And that's like the nutmeg and cumin type of smells. But all three of these will give an anxiety reducing effect. They're very sedative. It's that kind of couch lock. It can increase adenosine in the brain. It can get people sleeping better. This one's really important. For nausea, nothing does a better job, okay? So when you combine the limonene, pinene, and caryophyllene is the black pepper. That's the black pepper smell, that terpene, right? That's really amazing sensory experience you have with pepper. They're all really uplifting and they keep you awake during the day. But for nausea, that limonene, pinene is so good to calm it down. And when you use a vaporizer and you use a 3-to-1 to a 1-to-3 THC to CBD, so right in the middle, so it's close to that 1-to-1. It can vary a little bit on either side. You can get amazing results and you can dose really regularly over time. You can just keep dosing in short intervals and people can just sip little teeny bits as they need to control their nausea. It's just so far outpaces any other medication I've ever used or seen anybody use for nausea due to chemotherapy, nausea due to any other kind of other sickness. So it's the number one remedy for nausea and appetite suppression in cancer patients, hands down. And I always say use the whole ground flower, the low temperature vaporizer, sip it slowly, high limonene, high pinene, high caryophyllene. So what are the ways that people take in cannabinoids, right? Well, the oral method, the edibles, capsules, oral mucosal I described, the sublingual drops, lipids, tinctures, the liposomes. The topical forms, where you're taking creams, salves, or patches, or then inhale, and it's smoked or vaporized cannabis flowers, extracts. So sublingual, the big benefit is that you get to skip that first pass where the liver breaks it down. It gets to go right into the bloodstream here through the oral mucosal membranes. Faster onset than oral administration and a lot better uptake. The topicals are interesting because they're really good for localized treatment generally. Sometimes people will use enough topical that it delivers it over time and you get some of the cannabinoid effect. But generally, the skin compartment is a little bit separate. It sort of has a different interface with the bloodstream. It doesn't just go direct. There can be storage and slow release. So that systemic distribution isn't nearly as normalized as it would be with either other methods of taking it in. But so you can use certain terpenes, like fenchone from fennel. You can use the methyl salicylates. You can use lots of aromatic terpenes that can help bring things in. Camphor and menthol are really good like that. Can help to bring the CBD into the skin or other cannabinoids to get into the tissue and help with local pain, especially. So when we look at part of with cannabinoids, one of the problems is the fact that there are contaminants that gets into it. And you got to make sure you're finding the best products, whether you're a patient looking for your materials or you're a doctor doing the research. You need to make sure that you look for all these things. And foreign matter, fungi, yeast, and molds, right? Bacteria can be there. There can be agrochemicals and solvents and metals. And that's why the industry has to be regulated to some degree, because otherwise people are just out there to make a buck, getting this stuff into the market, and we don't know what's there. It's just not okay. So you got to really vet your sources with this stuff. Agrochemical contaminants, right? Like the pyrethroids, right? These are insecticides. They're just, really, really harsh on our bodies. Neurological toxins, the carbamates, like the organochlorides, organophosphates, they can disrupt the nervous system. They're really, really not good for us. They can cause all kinds of problems. And chronic exposure even has been connected with Parkinson's disease, it's been connected with, hematological malignancies. So again, we have to be testing our products, grown organic, taken care of, third-party tested, all that. Fungicides, fumigants, plant growth regulators, all these things are potentially in our products. But I wanted to say vaporizer cartridges, they tend to be kind of this thing. People say, oh, it's, the vaporizer, it's great, no problem. And propylene glycol, I don't like that stuff. Some people are really sensitive to it. It can irritate the lungs. It's got formaldehyde as a degradation product, as our liver breaks it down, turns into propylene oxide when it gets too hot. So, I don't like propylene glycol in general for anything. But so people go to vegetable glycerin, but there's still this thing, you're in this oil and you're vaporizing a lipid in the lipid and you're putting it into the lungs. It's very dampening and it's just not what we should be taking into our lungs. It's not a good idea. So some of the additives here, the propylene glycol, like I said, a lot of problems with it. Vegetable glycerin can still be problematic. I always say get to that vaporizer for the patient that has the material that you put into the vaporizer. It's ground up fresh and then it's vaporized at a low temperature. So you're just getting the oils off of there and you're just getting that nice light vapor, not this heavy vapor of all this, lipid that's just really dampening and sticking to your lungs and inhibiting certain functions. The terpenes, really important part of it. Too high of terpenes, like when they're artificially added, you can get too much of them. It can be harsh. Medium chain triglycerides can also be problematic if you're vaporizing them. Squalane and squalene, these are things that we don't like to inhale. We shouldn't be inhaling them. We can eat them, but not inhaling them. Same thing with vitamin E. It's not a good thing to inhale. So we have to be careful what's in there. And when we're evaluating product quality for our patients, we're trying to help people do their own research so they can find the right products. You need to look at the cultivation. Where were the plants cultivated? What parts of the plant were used? What are the suppliers? Do the suppliers meet quality specifications? Are they operating according to GMP standards? Good manufacturing practices. That's important stuff. It takes a lot of work to get GMP certification. It's a heavy duty thing. Lots and lots of very specific actions to be taken by the company that ensure the quality of the material. And it costs a lot more money. And certificates of analysis. You need to have third-party labs evaluate. So you get a material that's going into your product that you're making. That material sits in a quarantine. You take a sample of it, send it to your third party. They bring it back and say, yeah, it's safe. It's good. It's got all the things that you wanted in it. It doesn't have any contaminants. Okay, good. Every product and everything should have that. But one of the ways at least with every supplier who sends you something, every year you have to evaluate the product you're getting from them at least once a year to make sure that they're validating that their validation is correct. Formulation, right? You can use, oftentimes it's really good to get a product that has some thought into it and that's got better potency, better absorption, better bioavailability. CBD is safe, really safe. Mild lethargy and gastrointestinal stress are the only problems with it, right? A lot of factors can influence the quality. Like I said, potency and purity testing, really important stuff. So when you're evaluating products, GMP, are the product batches tested by an accredited laboratory for cannabinoid potency? Are product batches tested for chemical and microbiological contaminants, pesticides, bacteria, fungi, heavy metals, all the things we said before, right? And then the packaging. Does it allow for proper dosing? Just put graduated marks on the dropper so people can know how many, how much they're getting. Does packaging protect product quality? Is it in a dark bottle? Is it, are you able to get instructions to keep it safe? Because it will break down over time. So my final slide, as I say goodbye to everybody today, who should use cannabis medicine? Well, the endocannabinoid system has regulatory effects across so many systems. It's just woven into everything. And I said before, complexity is the name of the game. Plants are beautiful and they do so much work for us. They help us deal with stuff that we can't understand. Our single molecule, single target pharmaceutical approach is not the way to treat chronic disease. But we lost a lot of our knowledge about this plant. So we're rediscovering it. And it's also a plant that's so diverse in its different manifestations that we have a lot to learn about it. Unique physiologies in people with their SNPs and their epigenetics. Unique cannabis profiles with cannabinoids, terpenes, flavonoids, and other molecules. Complexity, right? So this takes an individualized, comprehensive approach. You look at the data that I've given you. I shared a lot of clinical experience from myself and my colleagues. And then always take your macroecological perspective from your traditional system, whatever your way of looking at the black box of the body, use that first, and then use your microrational dissection of individual components and the research to understand what's the right application, put the two together, and you can make the best decisions as a patient or to help your patients find their way through this tricky mess. Okay, everybody, have a great week ahead. Can't wait to see you next year. All my best. Bye.